Fatigue isn't just being tired. It's feeling like your body's out of fuel, like you're running on empty no matter how much you rest. If you live with ME/CFS, long COVID, or fibromyalgia, you already know this. And maybe you've heard that CoQ10 might help. But here's the catch. Most people take CoQ10 the wrong way and never feel a thing. So is CoQ10 actually worth it? In this video, we'll break it down. I'll highlight what the research says, and by the end of it, you'll be sure to give this supplement a second look. I'm Dr. Courtney Craig. I've lived with ME/CFS for 26 years, and I've spent the last decade helping others manage post-viral illnesses through evidence-based nutrition and supplement strategies. In today's video, I'll show you what CoQ10 actually does, what the research says, and why most CoQ10 supplements don't work, and how to find the right one for real results. Millions of people with post-viral illnesses are desperate for something to ease the crushing fatigue, brain fog, and pain. More than 90% reach for supplements. But here's the rule I follow, borrowed from ME/CFS expert Dr. Charles Lapp, now retired. A supplement is only worth considering if it's safe, if it's backed by research, and if it's helpful in at least 50% of patients. CoQ10 fits that, but only under a few conditions. CoQ10 is a compound your body makes naturally. It's essential for mitochondrial function. It's what helps your cells produce energy. It also acts as an antioxidant, protecting your cells from damage. Levels decline as we age, and in ME/CFS and fibromyalgia, CoQ10 is often severely depleted. One study found that ME/CFS patients had lower CoQ10 levels than patients with major depression. Low CoQ10 means poor energy, poor recovery, and more oxidative stress. So yes, there's very good reason that this nutrient keeps showing up in research on post-viral fatigue. But here's where things get a little bit confusing. You've probably seen CoQ10 supplements labeled as either ubiquinone, the oxidized form, or ubiquinol, the reduced active form. It's easy to assume ubiquinol is better because it's already active. I used to think that too. But here's what the research shows. Most clinical studies use ubiquinone, and these studies still found significant benefits. That's because your body can convert between oxidized and reduced forms as needed quite easily. So the real question isn't which form, it's whether the supplement is actually absorbed, and we'll talk more about that in a second. You may have also noticed that in ME/CFS research in particular, CoQ10 is often paired with NADH, a compound involved in the first step of cellular energy production. Here's why. NADH donates electrons, starting the energy production process. CoQ10 then carries those electrons through the mitochondrial chain. The combination theoretically enhances energy production by supporting both ends of the system. Some small trials have shown that this pairing, CoQ10 with NADH, improves symptoms, but these studies are often underpowered and vary in dose and formulation, so it's hard to know how much of the benefit comes from CoQ10 alone. That said, you don't have to take NADH with CoQ10. Many people do well on CoQ10 alone, especially if it's high quality. Most over-the-counter CoQ10 supplements, regardless of whether they're ubiquinone or ubiquinol, aren't well absorbed. That's why so many people tried CoQ10 and they feel nothing. The issue is bioavailability. CoQ10 is fat soluble and poorly absorbed in standard powdered or dry capsule forms. Some clinical grade formulations do work. The two most studied are VeziSorb, a patented delivery system that increases absorption. One study found that it raised CoQ10 blood levels by 300% in just 10 hours. Now, if you've never heard of VeziSorb, you probably have because it's used in brands like Pure Encapsulations. The second one is Kanika CoQ10. This is also widely researched, patented, high-quality form that uses an advanced delivery format. Never heard of this one? Well, if you take products from Research Nutritionals, this is the CoQ10 that they use in their products. So, reduced or oxidized form may matter, but only a little bit. Bioavailability matters a whole lot more. Check your labels. A good CoQ10 supplement should tell you which form it uses, ubiquinone or ubiquinol, what delivery system it uses, like VeziSorb, and whether it's third-party tested or used in clinical trials. If it doesn't tell you those things, don't waste your money. And one more tip, always take CoQ10 with food that contains fat. It's fat soluble, so taking it on an empty stomach reduces absorption significantly. Let's look at some research. In ME/CFS, several small trials, especially those using CoQ10 with NADH, have shown improvements in fatigue, cognitive symptoms, and sleep quality. A 2022 review by Tsai and colleagues found promising trends, but most studies were small and used varied formulations. In fibromyalgia, the evidence is even stronger. A 2024 systematic review found consistent improvements in fatigue, mood, pain, and sleep. Many of these studies use CoQ10 alone, not with NADH. In long COVID, research is just beginning, but given the shared mitochondrial dysfunction in these conditions, CoQ10 is a strong candidate, and several early trials are underway as we speak, especially in Europe. Clinical trials have used anywhere from 50 milligrams a day to 3,000 milligrams per day, but most people respond well to 200 to 300 milligrams per day, assuming the product is well absorbed. As always, start low, go slow. If you tolerate it well and don't notice improvement after a few weeks, consider increasing the dose gradually, preferably under the guidance of a clinician. So, bottom line, should you try it? If you're dealing with post-viral fatigue, and especially if you're over 50, I would say yes, CoQ10 is worth trying, but only if it's a high-quality formulation like Vesisorb or another, and only if you take it with food, and only if you give it several weeks before you judge the results. Don't expect miracles, but for many people, it can make a real difference in energy, cognition, and recovery time. Full disclosure, this is not the cheapest supplement. If you don't have the budget for the best quality one, skip it. And as always, talk to your doctor before adding new supplements, especially if you take medications or you have coexisting conditions. I've spent decades living with this illness, first as a patient, then as a clinician. I make these videos to help you cut through the noise and find science-backed answers that could actually help. Have you tried CoQ10? Did it help? Let us know in the comments. Your story could help guide someone else. You'll also find a full blog post on this topic linked below with all the research citations. If this video helped you, please like and subscribe and hit the bell so you don't miss the next one. Thanks for watching, and I'll see you in the next video.